Thank you all. Thank you, Smiles to see. I'm really honored to be here. When I was advised about Smiles of C, I thought, I'm a clinician. How can I give a TED Talk without any before or after pictures? That's what I do. I have a slide of what I do, and then I show what I did right or wrong, and then I discuss it. So I thought I'd start off by just telling you a story. This is a true story. It's a 30-year-old. Imagine you're a 30-year-old female. You're getting married in 4 months. You're in braces, getting ready for your wedding. Your 2 lower front teeth are class 3 mobile. You can move them with your tongue backwards and forwards. This x-ray was texted to me, as many x-rays are texted to me as a periodontist, in my opinion. This was one of my really good friends, receptionist. I looked at the x-ray and I'm like, this is ridiculous. These teeth are hopeless. They need to go. My friend called me, she said, you know she's getting married in 4 months. She's not gonna wanna walk down the aisle with a flipper or transitional or temporary. And I said, you know, Deb, these teeth are hopeless. There's no bone around them. We had a CT scan, showed no bone on the facial, no bone on the lingual. There were fistulas on the facial, fistulas on the lingual. The teeth were class 3 mobile, even though they were wired with orthodontic brackets. So I saw her and I said, you know, I do a lot of stuff to save teeth, but I need magic dust. She's like, will you please try? So I started addressing each etiology. I sent her to an endodontist to do a root canal. The first person refused, said there's no bone around these teeth, we're not treating her. The second person called me and said, Hannah, what is wrong with you? These teeth are class 3 mobile. I said, shut up, just do the endo. I wanna do her laser treatment. And that's what I was gonna do, a laser-assisted periodontal therapy. So she had the endo on 24 and 25, the lower incisors came in. I literally held her teeth with my hand and did laser-assisted surgery to remove diseased tissue, to improve the periodontal pocket, to destroy the gram-negative obligate anaerobic bacteria that lived there. And then she did really well. Well, of course, she's in the dental field, and you know, all of us that are in the dental field, we have no time to take care of our own teeth, so I never saw her for a follow-up. So 4 months later, I called my friend and said, would you mind taking an x-ray on her so I can see what the bone looked like? She sent me an x-ray, 100% bone filler. I didn't add any bone, I didn't do anything. So they took her braces off, and then I was able to follow her virtually through my friend, because again, she's now the office manager and is super busy. She would send me x-rays every few years. This December will be 6 years since the teeth were treated, and I saw her at the grocery store, and she gave me the biggest hug and said, you saved my teeth. And that is the pivotal thing, what made me go into dentistry, to change someone's life. So lasers, why did I do it? I saw the writing on the wall about 10 years ago. I'm not one to jump into technology blindly. And so I looked at a laser and I thought, how can I innovate my practice? How can I treat my patients better? How can I do things better than I was taught in residency? So I got a laser. And I remember there were so many skeptics. Are you crazy? Do you know how many blades we can buy for $100,000? It's true. But think about this. Martin Cooper invented the cell phone technology when he worked at Bell Laboratory. He went to his superiors and said, hey, we can give everyone their own phone in their hand. They're like, are you crazy? Why would anyone want a phone in their hand when they can use a payphone on any corner? That kind of small thinking, and look at it now. Would you ever go without your phone? I drive back home to get my cell phone when I leave the house. So he had a clear vision. Having a vision to innovate is what we need to do in dentistry. There's a lot of great technology that we must adapt for not only ourselves, but our patients. Lasers come in different wavelengths based on the material you want to treat. If you want to treat soft tissue, you use an Nd:YAG laser. If you want to treat hard tissue, you use an erbium laser. If you want to treat periimplantitis, you use erbium laser. So it depends on what kind of tissue you want to treat. So the questions you ask, what kind of laser should I buy? Again, what kind of tissue do you want to treat? 2, is it a reliable piece of equipment? Is the training good? Are you going to be supported? 3, is it an innovation to your patients and your practice? I can honestly tell you that the laser was a complete game changer for me. There were a lot of skeptics, and there are a lot of skeptics when something is new. I was skeptical, but that one case solidified my experience with laser. Then I started expanding my treatments. The third, probably the most important question, all of us that are in practice, that own our practices, will I have a return on my investment? And I can honestly tell you, without any marketing or anything, I paid the laser off in my first year of practice. I simply put a sign in my lobby that I can treat your periodontal disease with lasers. Patients understand how accurate laser treatment is. It's minimally invasive, it is profoundly safe, and they understand from medical technology that lasers are here to stay, and it needs to be adapted in dentistry. So I'll finish off by another story. True story, one of the sweetest old man I've ever said. He's 91 years old. He has multiple myeloma, which is a bone marrow cancer. He comes in, he's in a walker that has a seat. He walks a little bit, he sits. He had been to 4 different specialists to treat what is called osteonecrosis because he's on IV bisphosphonate. And anybody out here that knows about, and if you see it, it is a very difficult thing to treat. He came down, he finally got in, sat down, and said, honey, all I want to do is be able to eat. Nutrition is really important. He's 91. He has multiple myeloma. The rate of osteonecrosis with IV bisphosphonate is 30 to 40%. If you didn't treat him, he's going to die. He's going to die of sepsis. So I said, sir, I've never tried this, but if you're willing to try it with me, I'll do it. So I treated him with the laser. And 2 weeks later, his son brought him in, and I was profoundly shocked. His osteonecrosis had healed over. He had been to his primary care, to an oncologist, to an oral surgeon. Nobody wanted to treat him. They just gave him Paradex and said, rinse with this. So I was able to cure the osteonecrotic site and profoundly change this man's life. So then he was ready to go on to the upper arch, and we did that. And I followed him for several years, and he did great. Unfortunately, he died from his multiple myeloma, but he didn't die from sepsis from the osteonecrosis. So the point of my story is you have to be willing to innovate, to change, to grow, not blindly accept new technology, but be willing to change. I'll close up with this final statement from Charles Darwin. It isn't the most smartest, the strongest species that survives. It is the one that is most apt to adapt. So we all need to adapt in dentistry and find something that will make us innovate and grow our practices. Thank you.